Baltimore City Health Department will be under new leadership in the coming months.
Mayor Brandon Scott has appointed Dr. Michelle Taylor as the department's new health commissioner. She joins us now live. Dr. Taylor, thank you so much for joining us. Oh, and we're having a little bit of trouble hearing you.
So glad to
There we
be
go.
here. Hi.
Awesome.
Hello.
Well, we know this is a relocation for you. What drew you to the position in Baltimore?
Well, you know what? I am a native Memphian, but I actually lived in Baltimore for 2 years when I was a graduate student at Johns Hopkins. And I've always loved Baltimore and the DMV area. I'm a Howard grad, undergraduate school there. So I've been drawn back to that area many times for education and work. And it was just a natural fit because Baltimore is a lot like Memphis. Memphis is, and Shelby County is a city of neighborhoods, and Baltimore is definitely the same. And so when the job became available and more than one person told me I should think about applying, I decided I couldn't pass up the opportunity to at least try to come and serve the people of Baltimore.
All right, so you mentioned you're from Memphis, Tennessee, and you talked about some of the comparisons and similarities, I guess, between Baltimore and there. Are there any differences or challenges you expect to see here really that you didn't see in Memphis?
Well, obviously, my accent is a little bit different from the Baltimore accent, but also music is a little bit different. Our crab cakes are not nearly as good as yours. But we have excellent barbecue, and yes, I do know how to make it. And when you're talking about public health, the health challenges that Baltimore City has are very similar to what we see in Shelby County. We are also dealing with an opioid crisis. We're dealing with rising STI rates. But we also know as public health professionals that there are things that we can be doing to start to bring those rates down. And so I'm super excited that Mayor Scott decided to select me to be the next health commissioner for the Baltimore City Health Department. And I am looking forward to bringing some of the tools that we've used in Memphis and Shelby County to make Baltimoreans healthier.
Oh, you talked about some of the similarities and differences. We know that gun violence is a big issue here, just like in Memphis. How do you tackle the issue in your previous position? How did you tackle that?
Well, you know what? There are a lot of things that we have to do. And I will tell you that I was actually in Baltimore about a year ago, seeing what kind of progress you all have made in Baltimore. Mayor Scott's initiatives out of his Office of Neighborhood Safety have been excellent. I know that you all have seen a lot of reductions in gun violence and community violence as a result of some of the work that's being done. And many of the teams here in Memphis are looking to either come to Baltimore or have already been to Baltimore, like me and my team at the Shelby County Health Department, to see what we can do to replicate what's being done in Baltimore so that we can also see some reductions in violence. So I am super excited to come and not only learn from the people in Baltimore doing this important work, but to also contribute some of the things that we are trying in Shelby County.
All right, Dr. Michelle Taylor, a lot on your plate, but you sound well equipped. We're happy to have you as the city's new health commissioner. Thanks for joining us today.
I tell you, I think you set yourself up. Some of your new coworkers are going to want to try that barbecue that you're bragging about.
Us too.
Hey, I'm more than open to that. I also make a mean lemon pound cake. So when you all come by the Baltimore City Health Department and we're not being quite as healthy that day, I'll have to do that.
Free pass on that.